Okay, just letting everyone know that we're about to record. If you can accept that, that'll be fantastic. Okay, so welcome to the Justice Health Graduate Recruitment Program information session. I'm really pleased to see a few students here today. That's excellent. I know that people have got pracs, exams. It's that time of the year that everything's happening. So thank you for making the time to come. First of all, I'd like to do an acknowledgement of country before we start. In the spirit of reconciliation, I would like to acknowledge the custodians of the many lands on which the university conducts its business. In doing so, I also acknowledge the elders of those lands past, present and future, as knowledge holders and as key stakeholders in the education and employment of Aboriginal and Torres Strait Islander peoples. So thank you for today. I'm Julia. I'm the Manager of Employability and Careers here at UNE, and we also have Lisa Post who's participating today. She's our careers coach. So as a nursing student, you should have lots to do with us over the next few months and keep us busy with your applications, and hopefully Justice Health will be one. We've got Sophie and Angelina here today, and I'm going to hand the session over to them because I know they're busy ladies and they've got lots of information for us. Please take notes as we go. And if you've got questions, use the chat box and we can see that, so we hopefully can work through those questions as well, because we want to make sure you get the personal information that you need for your application. So I'll just share there we go. Hopefully the ladies can share their screens now. I'm always worried that I haven't ticked the right box. We should be right. Oh, looks good. So over to you, Sophie, by the looks of it.
Thank you, Julia. It's lovely to see that some people have logged in. And just a second, what Julia had said, I recognise it's a busy time for all of you. So thank you for taking the time to come and listen to Ange and I talk about where we work and where we'd love to see some of you work in the future, hopefully. My name's Sophie. I am the coordinator of our mental health programme here at Justice Health. I'd also like to acknowledge that I'm joining this meeting from the land of the Bidjigal and Gadigal people, and acknowledge any elders past, present and emerging, and also extend that acknowledgement to anybody joining us with a lived experience of mental illness. I might let Ange introduce herself and then we can talk through some of what we have to offer you guys.
Thanks so much, Soph. So my name's Ange, or Angelina is my full name. I am the clinical nurse educator for our custodial graduate nurse program. And I also, just like Soph, will echo the traditional owners of the land and in which we meet on today. Yeah, thanks, Soph.
Thank you, Ange. So what you might have noticed already is that Ange is the CNE of the custodial health programme, and I am nurse educator of our mental health programme. We do have another colleague, Rosie, and she's the coordinator of the custodial health programmes. And she unfortunately couldn't join us today. But if you guys have any questions going forward, we'll give you our contact details, which goes to a shared inbox that we all have access to. So just if you get a response from Rosie, she's part of our team as well. So I guess what we'll start by kind of going through is just what we actually do as a network. We are not necessarily the most well-known of networks, because we're not one of the big LHDs, but we're actually the largest geographical healthcare provider in New South Wales. So we're spread all across the state. There are 42 correctional centres, and we also have 2 inpatient hospitals on the Long Bay complex, which is based down in Malabar. Some of you may have been on placement with us before. We have lots of nursing students come to us from UNE, particularly to our rural centres. So if you have done a placement with us before, please feel free a bit later on to contribute some of your experiences if you think it'll help with sharing information. So we provide healthcare in custodial settings, which is often quite a complex environment. We work alongside corrective services for the most part in our custodial health graduate programs, and we care for patients who are in contact with the criminal justice system. So as much as our grad programs are based in the custodial settings or in the forensic hospital, we actually have staff that work in the community, out in courts, and kind of in a lot of different spaces. So what we do, we have this sort of specialised workforce. It's important to note that when we talk about these programs, I'll kind of talk about them interchangeably, but they do vary, they are a bit different. We are a specialised workforce and we are with New South Wales Health. So applications for our network will be through GradStart 2023, which I'm hoping you guys have had a look at the handbook and kind of getting familiar with that process. We work alongside LHDs and corrective services to make sure that the patients that are in our care get access to the appropriate treatments that they might need. So largely our settings are pre-hospital and very primary health focused, but that doesn't mean that you don't have a varied experience, because we also have lots of emergency responses, chronic healthcare conditions. The next point on our little screen here is that the healthcare needs of our patients are often quite complex, and I guess one of the things I could tell you is that our average age is 35 in custody. So the average age of our patients is 35, and most of them will have 3 or more chronic health conditions at that age, which is pretty significant if you consider the age and having three separate comorbid healthcare conditions to battle. And I think it's important to note that the social determinants of health are often mirrored with those of ending up in custody. So the health of our patients can often be less than what you might see in a broader community space. So we are very careful to include as many specialties as possible in our network. We have drug and alcohol specialists, psychiatrists, psychologists. Well, actually, psychologists are more in the mental health space, but I'll explain the difference later. We have the ophthalmologists coming in, all sorts of specialists that come to provide care for our patients, depending on what they might need. And you guys would be the first point of call for those patients in a custodial setting. So we have 4 programs. The Custodial Health Graduate Nurse Programme in the metropolitan area. I don't know if many of you are joining us from a metro area or rural, but obviously, you know, having a position in GradStart might see you wanting to move around the state a little bit. Our metro programs are based mostly in the Silverwater complex, which is out near Auburn, the Long Bay Correctional Complex, which is down here at Malabar, and then we also have the Francis Greenway complex, which is out at Windsor. And we also have a space in Cobham, which is our Youth Justice Centre. Is it Cobham that you have a grad, Ange? Yeah, fantastic.
Yeah, that's correct. Yeah.
Excellent. So we have a variety of populations that we care for within the graduate program. So adolescents that are in youth justice, females, which are based out at the Francis Greenway complex and at the Silverwater complex. There's not as many females in our Long Bay complex. We also have the Mental Health Graduate Nurse Programme, which is the programme that I coordinate, and that's mostly based in Malabar. I'm not sure if any of you have heard of the Forensic Hospital before, but most of the rotations in that programme are based in the Forensic Hospital, which cares for patients who have, for the most part, been found act proven but not criminally responsible through court proceedings. So what that means is they've committed an offence, but they have been found to have diminished responsibility for that offence because it was driven by a mental illness. So quite significant trauma in our patient population, irrespective of which centres they might be in. We also have our custodial mid-year intake, which I don't think will be something that most of you are thinking about for this year, because obviously you're still studying. It's not set in stone though, so we don't necessarily run that every year. We'll start with the location. So I said to you that we're spread across everywhere, and this is a horribly squashed map. I apologise. But just to sort of demonstrate that we have, facilities as far up as basically the border of Queensland, and down, away, like what's our furthest south? Is it Cooma? We've got somewhere further than Cooma, I think, actually, don't we?
We don't currently have a grad in Cooma, but I think we will be placing one. So Cooma for us would be the furthest south that we go. The furthest inland that I've got a custodial graduate is as far as Wellington, which is near Orange and Dubbo. And then the furthest north that I've got a grad is Mid-North Coast.
Excellent. So we cover a lot of ground, and that's because obviously there's a lot of spaces where we have patients in Justice Health. And I think it's interesting, we've obviously been to a few expos now in the sort of run up to the Grad Start 2023 campaign, and often people are quite surprised when they say, well, what's Justice Health? And we explain that that's providing healthcare in a lot of our correctional settings. And I think it's something that we don't necessarily think of as health professionals. You know, you think, oh, I'm going to go and study nursing, I'm going to work in a hospital. But as you know, we've got nurses in schools, nurses in a lot of workplaces, and we absolutely have nurses and healthcare professionals that work in jails as well. One of the alarm bells I think that a lot of our students have coming in is that they're not going to be safe with us on placement. And just to reassure you, we have never had a student injured by a patient ever in the history of the network. And there have been staff injuries at times, or staff incidents, but our incident rate is actually far lower than you would find in ICUs, emergency departments, aged care. So I think it's really important to point that out. We probably have a bit of a reputation for being a dangerous place to work, but that's not actually reflected in the statistics or in staff experience. But you're welcome to ask questions about that later. There's no such thing as an awkward or silly question. So obviously the Metro programme is based in the metropolitan area. Rural is located in a lot of those different spaces we saw on the map before. And placements and rotations through your grad programme will be, you know, in either maximum, medium, low secure, and our inpatient facilities are all in the Metro programme. So the Forensic Hospital, Long Bay Hospital and Silverwater MHSU is also technically considered inpatient as well. And I might let you talk a little bit about the custodial programme, just because that's your jam, and I'll take over for the mental health. I think you're on mute, possibly, or not.
Yeah, not a problem. So on our, can you hear me?
Sorry, yeah, I don't know if it was delayed for me or for everyone else, but that kind of came through like a little whap, which would have been cool if that's what I wanted to do, but.
We'll give it another go.
Yeah. Can you guys hear me now, Julia?
Yes, we can.
Okay, wonderful. Sorry, gotta love this age of technology these days that we're all having to rely on. Okay, so as Soph previously mentioned, on our custodial program, we've actually got two locations, our metropolitan centres and our rural centres. We've got currently on our program, I think I've got about over 40 graduate nurses across both our mid-year intake and our February intake. And they do span across all the different areas that Soph showed us on the map. So with our custodial graduate program, that's actually based inside our healthcare centres in our jails. So inside the prisons, the setup is we've got healthcare centres and patients will drop in and we will provide any sort of healthcare that they require on site. So a lot of what we do is around primary health assessments. We do drug and alcohol, acute and chronic care. We do have specific population health nurses, but where the role of the graduate nurse falls into that, and any of our registered nurses, is we'll do some workups for our patients around potentially blood tests, medication administration, around your communicable diseases. In our female centres, we do have midwives that work for us, and they do work alongside our registered nurses and our graduate nurses in taking care of the women, and specifically around women's health. We do have about, I think 230 odd babies that are born in custody each year. Thus the role of the midwife and our registered nurses. Also alongside that, we've also got our adolescent centres, in which we've got two of our graduate nurses on our program. So one is located in metropolitan Sydney, as Soph mentioned before, at Cobham, And then we've also got another graduate located at Frank Baxter, which is on the Central Coast. So it looks a little bit differently when we look after our adolescent patients, because a lot of the focus with them is around education and rehabilitation. That's not to say that we don't provide levels of education and rehabilitation for our women and men that are in custody. They get access to a lot of programs on site. In terms of our custodial graduate nurse program, we offer our graduates a 10-day orientation. In between, we also give them a 5-day supernumerary week. So the first week of orientation is a 5-day stretch where we're face-to-face, and we will do introductions to our executive team, and we'll basically get the ball rolling on teaching you about the network and the role of the graduate nurse within the network, and really upskilling you and advancing the skills that you've already gained at university. We split that up because we understand that 2 weeks straight of face-to-face education can be a little daunting for people. So we split that up by sending our graduate nurses into the centres that they will be working in for the first 6-month rotation. And you will shadow your preceptor and some of the nursing staff that will be on site for 5 days. As I mentioned, we do 2 6-month rotations on our 12-month graduate nurse program. And we try and split you up and keep you on the same complex, with the only exception is with the juvenile justice centres. We will rotate one of the closest centres, or one of the nursing staff that will graduate nurses that are from a nearby centre. So with anyone that goes out to our rural centres, we will keep you on the same complex, and we will try and give you 2 rotations. One will be probably a maximum security rotation, and the other will be a minimum security rotation. Only because we find that we get different levels of education and exposure amongst the different centres. With our program, we've also got some assessments that we conduct throughout the year. So we've got a case study presentation where our grads will select a patient that they've cared for that may have comorbidities or has an interesting presentation to their clinic. And they will delve deeper into the case study around the care that was provided for that patient. Also, our poster is conducted during the second part of their rotation, and that's really just aimed at identifying where there may be a gap in education, whether that would be for the nursing staff, our officers, or our patients. And the aim of the poster is really to bridge that gap in education. Both those will go towards, what was the course, Sophie? Sorry, I can't remember.
That's all right. It goes towards the clinical honours to the University of Tasmania. So you can do that alongside your graduate nurse year, and you get credit for 2 assessments through working with us and from doing assessments with us as well. So it does kind of, it makes getting a postgraduate qualification a lot easier if that's something that you're interested in doing in your first year.
Thanks for that, Soph. Okay, I think that's pretty much the custodial program in a nutshell. If you guys have any questions, Sophie and I will take those at the end of the session.
Thank you, Ange. So just up on the screen there, you've got some examples of posters that some of our graduate nurses have created previously. And this is really kind of aimed at engaging you guys in quality improvement from the get-go, and that education provision that often we will include in a lot of assignments about how we're going to support patients in their care and empower them. So yeah, it's a way of kind of getting you used to doing that type of stuff in a supported way. And we have some wonderful specialists throughout our network who actually take the time to kind of go through this and give you feedback about you know, how relevant that information is, or some more engagement. So we get you linked in with our wonderful specialists. I'm thinking of our drug and alcohol specialist in particular, a man called Robert, who will, you know, take as much time as you want to sit and go through this type of information with you. The mental health graduate programme is slightly different. It's got one more rotation, and again, we're kind of only based in mental health specific areas in the network. So the Forensic Hospital down at Malabar, Long Bay Hospital, which is also at Malabar, and then Silverwater in the mental health screening unit out in the biggest jail on that complex. Often when you see anything about the jails in the news, it's like Long Bay Jail or Silverwater Jail. There's actually 4 jails on the Long Bay complex, and there's 2 hospitals. And out the Silverwater complex, there are 3. So just kind of a bit of information there. Our patients, like I said before, for the most part in the Forensic Hospital have been act proven but not criminally responsible. And then across the broader Justice Health network, we have patients that experience mental illness that may not be related to the offence that they have committed. Just as a mental health advocate over here, people with mental illness are far more likely to be a victim of crime than ever actually commit crime. Just want to put that out there too. But we care for people irrespective of whether they're forensic or not. So that looks like assessments in custodial settings. As you can imagine, they're not particularly conducive to good mental health to be in custody away from your family. We have an overrepresentation of Indigenous patients in our network, and that's a really important fact to identify. And you know, it's something that I think has been worked on, you know, Australia wide. But we have to recognise then the cultural components of being taken away from family and land, and really sort of make sure that we have the appropriate strategies in place to support people as best we can, and actually apply that non-judgmental care, which everybody's different, and working in Justice Health might not be for you, but I have to say I don't find it challenging to care in a non-judgmental way for our patients. When you understand a little bit about what's happened for them in the lead up to coming into our space, it's often a lot of trauma. So you're really using your trauma-informed care principles and things as well. So we work with patients right from an acute phase of mental illness right through to recovery. And in the Forensic Hospital, we have a graded step-down system that we use for our male patients. This picture in the middle is an inside peek at what the Forensic Hospital looks like. It's a 135-bed facility, and we are split up into 6 units with adolescents, males and females, all cared for within that facility. We have a slightly longer orientation than the custodial health programme does, and that's because a large part of our orientation is taken up by doing violence prevention and management techniques, and that's 5 days that we go through that with you. So we actually provide what's called therapeutic security in the Forensic Hospital, which means we don't work with corrective services. We, as nursing staff and all clinical staff, work together in a really sort of close-knit, tight team to provide multidisciplinary care for our patients and also maintain security from a multidisciplinary perspective as well. And that looks like a lot of de-escalation strategies, and then where needed, we may use restraint, but it's always in the least restrictive manner. I don't know if you guys can see, but I am about 55 kilos and 5'4", so please don't panic that you have to be a bodybuilder to come and work with us. It's absolutely not the case. We have a fantastic skill mix across our workforce, and what we always aim for is to use de-escalation strategies before there were any incidents. We have lots of education through our years, so you'll never have to worry about a CPD point as long as you live if you're working in Justice Health. We take a lot of the fact that when you're in uni, there's often a couple of subjects for mental health, but it's very primary health focused in terms of clinical skills and that kind of thing. So we do workshops throughout the year. We have lots of specialised nurses that provide education and ongoing support for you guys. And I think that's something that's really valued by our graduate nurses. We use reflective clinical supervision. Now, that sounds like a horrible thing where someone's going to come and watch your practice. That's not what it is. It's a space where you sit with your colleagues in a small group and that would be the colleagues of the grad programme, and you can discuss any clinical issues you might be facing. And that can be really useful in developing your professional abilities to sort of, manage conflict resolution or escalate care. And our grads also find that really useful and have said before that they think that they would have found that really useful in their placements, particularly working in other LHDs and that kind of thing. So I'm really glad that we have that in our programme. We have 3 4-month rotations in the mental health space, and we move you from acute to rehab or vice versa, but making sure that they have a really broad experience across both of those environments. And then we have 2 rotations through each 4-month period, which will be either at Long Bay or at Silverwater. So you get a really good opportunity to see the different spaces that we have in Justice Health and that patient journey, because a lot of the patients we care for in the forensic hospital have actually been waiting for a bed in one of the custodial settings for a prolonged period of time. And that has a big impact on how they present to us. We also have assessments as part of our programme, but please don't panic. They're not, marked and to turn it in and that kind of thing. It's very much about you kind of having the opportunity to get feedback on your ability to provide a comprehensive handover for a patient and analyse their care, or provide some education appropriate to whichever target audience you select. So you've got a lot of control over what you do in those assessments, and they're not pass or fail. They're opportunities to learn more. That's what they're about. So we have here a quote from, this is a lady called Sam Jones. So she was in our graduate nurse programme for mental health in 2019. And we have this in here because we really want you guys to have an honest impression of what a graduate programme in Justice Health might look like. About 60% of our graduate nurses each year come from our student programme. Sorry guys, that's my work phone going off. Come through our student programme, and that's totally understandable because I guess, when you're selecting your preferences through grad start, to select Justice Health when you've never stepped through the doors might seem a little scary. I would encourage you to talk to your colleagues, particularly ones that might have been on placement, and we're very proud of the feedback that we get about experiences through Justice Health. People often walk in day one, I meet them for their orientation for mental health, and their eyes are super wide and they're looking around very vigilant. And usually I'll ask if they're, I don't want to swear, but effing themselves, I guess. and that kind of breaks the tension a little. Now, by the end of the first week, everyone kind of has that direct exposure to what it's actually like to work in our space and recognize that we have so many procedures in place and do so much education and support with our staff that actually we're one of the safest places that you can work in New South Wales Health. I hope while Sam rambled, you've been able to read what Sam said if you were wanting to read that, but if you would like more information, there's also some on our website. So justicehealth.newsouthwales.gov.au, or you can just fire it into Google and then navigate through the careers section, and our graduate programs are advertised on there as well. And then we have this email inbox, which is the one that Ange, Rosie and myself all have access to. So if we will move to questions now, but if there's anything that you think of later down the line, or there's someone that wasn't able to join and is maybe watching this on repeat, feel free to reach out via that means, and you can ask any questions that you have.
So we've already got 3 questions in the chat. Lisa kindly wrote us some questions. So the first question from Lisa is, what do we most love about our roles?
Oh, I love
so maybe
that.
we can answer that first, and then I'll go on to the rest of the questions.
I love that. Guys, can I say it's a difficult question to answer. I really can't see myself ever working somewhere other than Justice Health. So I joined the network in 2017 as a graduate nurse myself. That was after coming here for a 2-week placement, and that was in the forensic hospital in the acute male admission unit. And I have to say, I was one of those students coming in with the wide eyes and what am I going to come across here? And my mum's like, make sure you text me, and wanting to really make sure that I was going to be all right. And as soon as I walked through the doors, the staff were unbelievably welcoming. I felt valued and listened to as a student. And there was a lot going on in the time that I was here on placement, but every step of the way I was included in debriefs and in meetings, in patient care. And for me, there was nowhere else that I wanted to go for my grad program. I had some excellent placements in other LHDs, but they didn't offer, I guess, the unique opportunity to work with a super vulnerable population and work with them across a period of time where you got to see meaningful improvement in their health. So what do I love most about my role? I guess everything. Can I say that, Lisa? Sorry, I don't. It's a great question. Everything. And is your answer different to that?
No. Look, like Soph, I started my career very early on. I was actually an AIN with the network whilst I was at uni studying my nursing degree. I kind of fell into Justice Health by coincidence. I was working for an agency and I got hurt on a ward in a brain injury unit in a private facility. And I thought to myself, there's got to be something more to nursing. And I got a call very reluctantly. I did not want to accept any more shifts in this brain injury unit. It was no offense to anybody, but I just didn't feel like it was for me. And I answered the phone quite hesitantly. And they said to me, oh, Ange, we've picked up a contract with Parkley, which is now privatised, but at the time it was Justice Health running the healthcare. And they said to me, we've got a contract with them. Would you like to go be our first AIN for the agency? And my honest first reaction was, what business do I have being in a jail, and what would I be doing as an AIN? And it was only because I have a sister who's a forensic psychologist and had worked in corrections for a very long time. And she turned around and said to me, well, why don't you just give it a go? Check it out, do one shift, and then you can make an informed decision about what it looks like for you and whether you enjoy it or not. And I remained there for the next 3 years of my undergraduate degree. Unlike Soph, I decided, because I'd worked for the network for such a long time, I actually wanted to work in a hospital just to see what it was like. Really, it was just, I only had very small interactions with the hospitals while I was on placement. And I said, okay, well, I might just give it a go, see what this looks like. As soon as I finished my graduate nurse program, I was straight back to Justice Health. And yeah, there's just, like Soph said, I can't describe what it is. And for anyone that works in our network, there's just something special about it that draws you in and keeps you there. But I can't pinpoint what it is. I really can't pinpoint what it is.
Yeah. I think
it is definitely.
There's about 14,000 people in custody at any one time, and there's about a 50% turnover each year. The average length of stay in custody is 2 years. I think people often think it's more. And I think to have I don't ever want to say being in custody is an opportunity, but a lot of our patients have never even seen a healthcare professional before. So in terms of that building trust and having the ability to work and overcome the barriers of health literacy or even some reluctance to see healthcare professionals. I already said we have an overrepresentation of Aboriginal and Torres Strait Islander patients in our network. And I actually care for a person who was part of the stolen generation, so she doesn't even know her birthday. So and she was taken away from her family by nurses. And so to kind of overcome that and try to reestablish a positive relationship and association with clinical staff, it can be really challenging, but it is very rewarding, I have to say, being able to do that effectively in our space. There's a lot of variety as well. There's a lot to love.
The next question is, what's the hardest thing about your roles?
So obviously currently I'm working in the graduate nurse program and have worked in education and training for the last 3 years, either supporting student nurses or graduate nurses or mental health education across the network. I think the hardest thing I've found about my role, I'll talk about my role as an RN, because that's obviously what we're hoping that you guys are interested in becoming with us, certainly in the first instance, but just as a side note, there is often a lot of development opportunities here as well. The hardest thing I think about my role is, or was, look, it can be difficult to care for people who are experiencing or who have experienced a lot of trauma in their backgrounds, and that can be, you know, it's a reason that we really do need to work closely together as a team and do a lot of check-ins, and we have a lot of strategies in place to manage that. I think it's just sometimes sad to kind of see what people have gone through before they come to us. And again, it just makes the quality of the care that we provide all that more important.
Thanks, Soph. So for me, I would have to say from a primary health nurse perspective, which is what I did with the network for a long time before I became an educator, it's a balancing act, and it's really like walking a tightrope, because we've got to have such a important relationship with our patients. First and foremost, as Soph said, they come from a lot of trauma. They don't trust people in uniforms, and we really have to break down those barriers before we gain anybody's trust. So that's a bit of a balancing act. On top of that, our environment is so unique and different. We work alongside corrective services. Without their partnership, there is no us without them, basically. And we would not be able to provide the healthcare that we provide if corrective services wasn't around. So it's really like just navigating those relationships. And once you figure it out, it's beautiful and it works. So I think it's just trying to figure it out at first.
Yeah.
So next question, Soph, is around the shifts so they differ between the custodial centres and where Soph worked at the forensic hospital. They do differ. I'll let Soph touch on the shifts and what they're like at the forensic hospital, and then I can talk to the ones in our custodial centres.
Cool. So for the most part in the mental health specialised areas, it's 24/7 care. So we have a morning shift, an afternoon shift and a night shift, and it'll depend what shift you're on as to what that shift would look like. Essentially what we do, and it's a really good question because we get so caught up in knowing what our day is like that to remember to say it is sometimes a bit lost. So thank you for asking that, Lisa. In the morning, you come in, you take your handover, the same as you probably have on all of your placements so far. And then what we do is probably start saying hello to our patients, making sure they know who they're working with for that day, starting to get some medications ready, and then also setting them up for breakfast. So we do all of those activities with our patients. There's not a lot of ADLs. In fact, I don't think I've done any ADLs in the forensic hospital, certainly not showering, maybe some education, but not actually ADL support. And then we will do breakfast with them. So obviously that's the time when there's cutlery out. So we have all of our staff on the floor. We're observing our patients, making sure that everything's as we expect it to be, which it more than often is. Then after that, we'll look at what therapeutic activities there are for that day. So whether there's art therapy, whether there is some rec call time. We have an indoor heated pool that our patients sometimes use, and that's very much part of trying to manage the effects of psychotropic medications on their physical health. So we'll work with them to kind of achieve what they want during their day, and that's something that I incorporate into every interaction that I have with patients. You know, what can I help you to do today? It's not what I'm going to do to them. I want them to be very much actively engaged in their day and their healthcare. So it depends really on what they want the shift to look like as far as possible. Now that's kind of a standard day, right? So then you've got lunch, obviously, then you've got your afternoon handover, your documentation, as well as clinical activities in between in services, whatever it might be. However, we also have emergency response teams, which even as grads, you're welcome to be a part of, where that might be that there's a medical or a psychiatric emergency somewhere else in the hospital, and you are running to that response. So, well, running or moving swiftly, I think is what the policy says. And you will bring emergency bags with you. So you could be in the role of a paramedic, you could be in the role of a primary care nurse, making sure that you're managing chronic health conditions. So most commonly we see diabetes, metabolic syndrome, poor cardiac health as well. Or you could be out, a patient's had a seizure over at the rec call or a cardiac arrest, or you know, any number of things really. So the day, in a normal day, it might look like what I spoke about before, but it's varied. Every day is different. And the afternoon shift is similar to the morning really, although it's a little bit less activity orientated. And then night shifts, most of our patients sleep, some get up through the night. And we do a lot of our reports at night. So I don't know if you guys are familiar with the Mental Health Review Tribunal. If you've been on a mental health placement, you may have come across them before. But as nurses, we are care coordinators for some of our patients, and that's always done in a group. So please don't worry. And it doesn't happen until your third rotation if you want to be a part of that. And yeah, so you might be sort of reviewing all of the patient's care and documenting that as a report to the tribunal about that person's progress. That's the FH mostly.
Okay, thanks for that, Soph. So in our custodial settings, it is a little bit different to the mental health forensic hospital. So with us, we don't actually work night shift. We do have 1 or 2 senior nurses, depending on the complex that you're on, but our graduate nurses aren't put on that shift. It's usually a 8th year RN. With us, we've got morning shift, usually a 7 a.m. start, depending on the centre that you're in. Some may start at 6, and the finish times around 2:30 to 3:30 in the afternoon, depending on your start time. And then the afternoons, they can start anywhere from about 12 in the afternoon till I think about 1:30 in the afternoon. And then our end times are around 8:30 to 10 o'clock at night. Just really depends on the complex that you're on. Will depend on your start and finish times. In terms of a typical shift, the only other if you're in a sentence jail that has long-term patients that are not moving, the routine's a little bit more different. If you're in the likes of like our Silverwater complex, MRRC, or one of the other, they're called reception centres, where patients will get brought in by corrective services from the police cells. There's a little bit more to do in terms of workup around the patient. So we do comprehensive head-to-toe assessments on patients. Not that our graduate nurses will be partaking in that comprehensive assessment, but they might be around to assist our more senior staff members. A day-to-day shift, what does that look like for us? Usually we come in, check drugs, we will see our diabetics in the morning, we'll conduct our pill rounds. We have supervised medications for some patients, depending on a lot of variants, whether they have capacity to understand their medications, whether they've been caught diverting. There's different reasons why we would place someone on supervised meds. On the flip side, there's patients that will come and collect a full day's worth of medications from our clinic. How and why do we do that? We actually have a special clause in our drug license that allows us to do that, and we have so for the whole time that we've been in operation. Because of it's such a unique environment that we just don't have capacity to have a nurse that goes around and delivers pills each breakfast, lunch, dinner, in between. We would need a workforce of about triple of what we've got. So that's why I think they've kind of embedded that into our practice. On top of that, we also do a lot of dosing around our drug and alcohol patients. So whether that's in the form of methadone, which is a liquid form, we've got Suboxone strips, which we're slowly phasing out, and also injectables. So stuff like our mental health depots for patients that aren't in gazetted mental health facilities. Buvadales, there's all sorts of stuff that we do in terms of seeing our patients. We run a primary health clinic where we will triage patients and see them off a list. And what does that look like for a nurse every single day? It could be you're doing a workup for a patient that's on clozapine. It could be a someone's experienced some chest pain the night before, or some, I don't know, GORD symptoms they might present. As Soph said, we also have emergencies in our centres. I think wherever you work with people, the likelihood of somebody deteriorating or something acute happening quite quickly can occur anywhere that you work. So we do expect all of our nurses, even our graduates, to respond to emergencies. But a lot of the training that we do with our staff will equip you with the information and the resources that you need to attend these emergencies. On an afternoon shift, it's slightly different. We often get movements between different jails. And they're called transfers in and out. We will assess them on an afternoon shift usually. Again, we've got our supervised pill rounds where we deliver pills to our patients. Diabetics, we have them throughout the whole day. And that's pretty much it in a nutshell. Yeah. There's not much else that we kind of do that we wouldn't do in a hospital. The only thing that we don't really attend to in our environment, as Soph said, it's the ADLs. We promote a lot of independence with our patients. Some of our patients are assessed, and if they show that they do take their medications and they're quite diligent with taking their medications, we'll actually put them on monthly medications and give them that opportunity for self-care in their cells without having to rely on the nursing staff, because we find that that equips them better when they're out of custody to care for themselves.
Yeah, it's a good point, Ange.
Yeah.
In terms of those emergency responses, my old boss, Douglas Green, who, if any of you ever come across him, is a wealth of knowledge. But he's worked in various settings in the network. I mean, you guys would have seen on the news, sometimes patients like to set fire to cells. So we do a lot of burn management. We have, like we've talked about before, lots of physical health conditions amongst our patients. So there's a lot of management that way. But our emergency responses can literally be anything. I mean, you can have car crashes in custody, snake bites, spider bites, whatever it might look like, everything in between. The next question was, sorry, the hours for the forensic hospital are 7 till 3:30 morning, 1:30 till 10 afternoon, and 9:30 till 7:30 night shift. So very similar to what you've probably seen in other spaces. We have, do staff or students usually live on site or in the nearest town? Well, you could ask them to clear a cell for you.
They might organise that.
Yeah. You might want to bring a couple of extra blankets if it's winter. But thank you for asking, Lisa. But no, so generally, yeah, you'd live in well, wherever suits you, really. I think it completely depends. I personally like to be about half an hour away from work. So, and our boss drives 1,000 kilometers a week to come to work, which he doesn't have to do. He could work from home, but he's, you know, he's very committed to what we do at Justice Health. We've got there about.
So I'll just touch, sorry, with the rule program, our graduates organise their own accommodation also, but they try and live close to the complex, because depending on which centre you're in, usually you're quite far out of the towns in certain areas. I can't attest to all of them because I haven't been to all the sites yet. I'm doing big travels this year, but some of the complexes are actually in the centre of town, like at Cessnock. If you go to Cessnock, it's not that far from the centre of town. So yeah, it just really depends on where you are, but there's no living quarters as such on any of the sites. I think only it's reserved to corrective services.
Thanks, Ange.
That's okay.
Extra allowances, Julia, there are extra allowances, but it's not specific to working out in Western New South Wales. We actually, as a network, have extra allowance no matter where you are. So if you're in a clinical role, you get an environmental allowance, which I think, honestly, if you told ED nurses that, they'd be pretty annoyed given our incident rates for staff versus theirs. But we do get a small increase. I think it's a couple of dollars extra on top of your hourly rate.
I think it's $3.54 an hour.
Oh, there you go. And then we also have a productivity allowance, and that's because a lot of our centres, you won't be able to bring in things like your mobile phone, which for some people that might be like, oh my God, I wouldn't live, but it's actually really refreshing because you can just leave whatever drama is happening on Instagram or in, you know, friends, family, whatever, in your car, and you can't deal with it for the whole time you're in work. So obviously when you can move around the centre, so if you want to go out on breaks, that's fine. But one of my favorite things about, in fact, I should have said that for the first one, one of the best things, not having my phone with me. So yeah, there are extra allowances across the network.
Yeah. So the next one, Soph, is just around how many graduates we take onto our programs across the year. So definitely not the 40 across Soph and the portfolio that I cover. I think the numbers just fluctuate each year for myself, depending on a lot of things, depending on how many patients we've got, depending on sometimes corrective services will close down certain wings, certain jails, bushfires will affect our staffing levels, floods will affect our staffing levels. Sometimes they will have to relocate people. So I have a little bit more, I have more positions because obviously we span as far as I told you guys before, as far as Port Macquarie, Wellington, and now I'm potentially going down all the way to Cooma. So I've got a lot of centres in between where our graduates can potentially be placed. We do have preferences and we will try and allocate people to their preferences as much as we can. But that's not always guaranteed either. We can't, if everybody says, hey, Ange and Rosie, we all want to go to Goulburn, we can't put 40 grads in Goulburn, potentially. We'll also have to balance the needs of all the different clinics, as well as the staff member that we're going to bring on. So there's a lot of, as I said, juggling in all facets with our roles. Currently, we're, I think, recruiting. So on my program, as I said, I've got roughly about 40 at the moment. And so you've got what, 16 or 18?
Yeah, so our numbers stay pretty stable, and we make sure that our numbers are, that our staffing levels are pretty set, and our patient capacity is always pretty full. So we have those numbers so that we can ensure you've got the right amount of support and preceptors that can work alongside you. So 18 is about standard, and just because it's often asked, our retention rate in the mental health program is also really pretty good. So I think everyone except one person who applied to stay on after our last group of grads was successful in getting a position. We actually set you up really well for that as well with an education day about applying, but I'm not answering the question anymore, so I'll stop talking. Yeah, so the numbers do vary quite significantly. About 18 for the mental health program, and it can be rough, you know, somewhere around that 40 mark. It could look quite different. Now, Ange did say about our settings sometimes being affected by floods and bushfires. That does absolutely happen. It's not very common for it to impact our graduate nurses. It can happen, but please don't be panicking that you're going to move somewhere and that everyone's going to end up displaced because of a jail closing. It's not that common. We've got here about the select preferences, thank you. But I will actually add in this point as well that when you do apply, if you wish to select Justice Health as one of your preferences, obviously I know you all want to put it as your number one. We look forward to seeing your interview. But if you did want to select us, then you have to differentiate between the three programs, and it's really important that you do that accurately, because if you apply to the mental health program, say, and then you say, oh, actually I wanted to do the custodial health, it's not that straightforward just to swap you over. The NAMO Grad Start campaign is not super simple. In fact, there's about 60 webinars between now and Grad Start that are going to help us on how to do that. But yeah, just as a consideration that you'll have to specifically select whether you want the custodial metro, rural, or mental health program as well. Were there any other questions, guys? Anything, you know, even if you want to ask something that you think might be a difficult question or something that we might know. I'm looking at Irene. Are you in a correctional centre, Irene? Yeah, she definitely is.
Yes, I am.
I'll be in tomorrow morning.
Where are you?
Delaney Area 1.
Delaney, there you go. So that's one of our female sales in the metro area. Interestingly, out at the Francis Greenway complex, we also have the wildlife where our patients care for injured animals. So when I visit John Maroney, obviously to see our grads and students and staff, and also to go and visit all the animals. We have blind possums out there. I have a little parrot-style bird who is actually my boyfriend. He always brings me twigs and things when I go and visit. So yeah, lots of variety in our network. Lots of things you probably wouldn't think about.
Well, that's fantastic, ladies. Thank you so much for your time today. Your the program's contact details are all in the community Moodle site. So there's an email that you can put some inquiries through if you think of something a little bit later. That's fine. But thank you so much. It's been a great presentation. And just to let everyone know, the head of school was actually popped in and had a look too, but she had to go as well. Otherwise, I would have introduced her at this time. But she was very interested too to see what students were interested and also what the program was about, because nursing is not her background, but she's definitely a health worker. So thank you very much for coming along. I'll stop the recording now.